You or a loved one taking multiple medications? If you are, you may have something called polypharmacy. You may have to bring this up to your doctor. Polypharmacy usually means you're taking 5 or more medications, although that definition isn't totally clear and objective with everyone. And although taking multiple medications isn't always a bad thing, because many times you actually need that. But problems arise when medications keep getting added without being reviewed, or people who are seeing multiple different doctors and those prescriptions aren't being seen by one person. People at risk include older adults or anyone with multiple chronic conditions, again, people seeing several different specialties, people who just got discharged from a hospital. Why does this matter? Because the more meds you take, the higher the risk of side effects, drug interactions, falls, confusions, etc. Some medications, if combined with certain ones, could be lethal. Sometimes a side effect gets mistaken for a new problem, and then another medication's added, and you get this cycle, and it's an issue. That's called polypharmacy. You should pause, you should ask questions. If you're taking more than 5 medications, 6, 7 medications, you should make sure that you have a primary care physician that's managing all of these medications. If you start feeling worse after new medications, definitely ask your physician, right? Bring it up. Bring a complete medication list to every appointment you go to, including supplements. Ask your physician every time if this is the correct medications you should be on. After a hospital stay, make sure you're following up with your primary care doctor and talking about the medication changes that occurred while you were in the hospital. The goal isn't always fewer meds, but the goal is always getting the correct and the right meds.